Doctors, who were your dumbest patients? Story 1. Had an old coot who was sweet but had clearly spent his adult years drinking away whatever brain cells he started with. He presented with a chief complaint of, "I can't drink beer anymore. Every time I drink one, I just throw it back up a few minutes later." Well, turns out Cooter hadn't been able to eat actual food in months, was subsisting on pretty much just beer, and hadn't pooped in over 2 weeks. But that didn't bother him a bit until he couldn't have the beer. Then it was an emergency. He had a big old tumor blocking the distal part of his left colon, so near the end of the road, intestinally speaking, and everything gradually got backed up all the way to his stomach. That's why he couldn't keep a beer down. There was just no more room at the inn. I fixed him with a colostomy, and he got better and left. He refused chemo, and I figured he'd just go home and die of cancer. But then, almost exactly 1 year later, he came back to me with just about the same complaint, obstructed to the point of not being able to drink beer. Except this time, it was that his ostomy had essentially retracted into his abdomen and the skin had nearly grown shut over it. He was pooping out of a teeny tiny hole in his skin. Even my oldest partners had never seen anything like it. But once again, Cooter wasn't remotely fazed. He just wanted us to fix it so he could go home and keep drinking. I did. Haven't seen Cooter since. I kind of hope he's still out there, treating his cancer with Budweiser and just blissfully ignoring the Grim Reaper. Story 2. Surgical resident here. One that comes to mind while I was on the cardiothoracic service was a gentleman that came in through the trauma bay with a stab wound to the chest. He reported, after we fixed the rather large hole in his right ventricle, that he was just visiting a friend, and while on the stoop of the building, a random stranger stabbed him with a sword from a first-floor window. He proceeds to laugh, get back in his car with his buddies, and drive home, despite the rather profuse bleeding from his chest. He drives home for some period of time, and then eventually decides he should go to the hospital. Drives by himself to the hospital. Last thing he remembers was being on the way to the hospital. Lucky man was found in the parking lot and had passed out in his car. Eventually made it to the OR and walked away just fine. Too long didn't read. Dude gets stabbed in the heart, decides to go home and hang out for a while, eventually somehow drives himself to hospital before dying and without hurting someone else on the road. I'm guessing he panicked and thought, there is no way that just happened. Well, okay, but it's not that bad. Nope, it can't be. Not a stab wound from a sword. That's a death for past people. Story 3. One more thing I'm telling on behalf of a colleague who doesn't like Reddit. In the wee hours of the morning, he got called to see a trauma consultant. It was a guy who reportedly wandered into the ER, stating he'd just come from a bus stop across the street from the hospital. He had just woken up there and realized that he was missing his wallet, as well as all of his clothing from the waist down. What, you ask, would prompt an indecently clothed man to march barefoot across a busy downtown road in a big city by the dawn's early light to seek assistance in the ER? Shame be darned, his bunghole really hurt. My friend did an appropriate workup and discovered a large chunk of broken-off concrete lodged in this gentleman's rectum. It required an operation to retrieve it. However, before they whisked him off to the OR, the patient confessed the rest of the story. He'd hooked up with 2 strange men off of Craigslist, and they'd gone out in one guy's awesome sports car, used copious amounts of illicit and ethyl alcohol, and done, well, at that point, he wasn't too sure just what they'd done. All he remembered was waking up at the bus station with no pants and a rock up his arse. And then, while my friend was still in the ER with the guy getting consent for the operation, the patient's very worried wife walked in. Story 4. There are several close calls. The patient who fixed an appointment for a pedicure the day after open heart surgery. He said that he'd just sneak out of the ICU and that nobody would notice. The patient who had an amputation of half of his foot and decided that it would be a good idea to walk to the toilet after returning to his room, covering the floor in bloody footsteps because the suture ripped open again. The patient who said that he didn't have any previous operations, but was basically covered in scars. When asked about each of them, he suddenly remembered having about 15 surgeries for various accidents. The patient who forgot that he had his kidney, spleen, and part of the colon removed because of a tumor. The patient who decided that he'd never take more than 3 pills a day, because obviously taking more than 3 pills a day is going to kill you. He was on 4 or 5 different meds at the time and basically just chose at random which meds he was going to take for which day. Good thing I don't take pills for my condition. I do, however, randomly choose how many units of insulin to take. Story 5. Not a doctor, but as an army medic, I have some dumb patients. One of the first guys I treated got really bad road rash from a motorcycle crash and decided to treat it himself by pouring whiskey on it. By the time he came to the medics, it was pretty bad, and I had to do debridement with a scrub brush. Basically, scrubbing the bad parts off with plastic bristles. He was in a lot of pain, and I was trying not to laugh at him. One guy came in with fluid-filled bumps on a red base around his mouth. Textbook herpes. I asked him if it was his first herpes outbreak, and he started yelling at me for saying he had herpes. He refused to listen to anything else I said and asked for the PA, who took one look at him and asked if it was his first herpes outbreak. We once had a guy who had the tip of his finger amputated. His first question was, "Will this grow back?" One guy had a sore back, and while I was doing the physical exam, he said, "Doc, my spine is curved." It wasn't. That's why my nose is crooked. Story 6. Had a Marine once who came to me complaining of a rash to his right forearm, C2 weeks. This was his first visit for the issue and hadn't had anything like this before and was worried, since he reported worsening symptoms since initial onset. When asking about prior skin issues, he told me he had ringworm just prior to this rash. Look at his arm. It looked like a mild second-degree chemical burn in a rather circular shape with blisters on the edges. What got me was the exact definition in the burn edge. Asking the young LCPL how he got that, he replied, "Well, that's the burn I got from the bleach I poured on my arm." When I am asking him why he poured bleach on his arm, well, how else was I going to kill the ringworm? I did that once. Junior high wrestling, thought it would clear up overnight. Obviously was not cleared to wrestle. Learned my lesson. Story 7. I was an intern in the ER. I've seen a lot of stupid people. It was a small town and all. The worst thing, I think, was when I walked in and the floor smelled like, I don't even know. It was by far the worst thing I had ever smelled. I asked a passing nurse what the smell was, and he just shrugged his shoulders and told me someone probably pooped everywhere. Well, the doctor is preparing to go into this room, but I did not expect what would happen next. He opened the door, and I almost barfed. It was extremely hard to keep my professional composure. The guy had his leg wrapped up. The doctor asked him to unwrap it, and it was gangrene, from his foot up to the middle of his thigh. The smell I had been smelling was rotting flesh. The cause? The four-wheeler I was riding caught fire 6 months ago. Story 8. I'm an ER doc. I once had a 20-year-old and his girlfriend come in at 2 a.m. freaking out because something had torn his throat open. He seemed fine, no blood, breathing fine. I had him open his mouth and saw nothing. So I didn't want him to lose confidence in me. Clearly something had happened. So I'm looking and looking. There's nothing wrong with this kid's throat. Finally, I say, "Look, it seems okay. What do you feel or see?" "I don't feel it, but look, it's right there." "Where?" Looking. It was his uvula. Somehow this kid had got to the age of 20 without ever noticing his uvula. Girlfriend was also horrified. I told them it was normal, did not believe me, so I told them I was about to blow their minds, and showed him his girlfriend's uvula. Minds blown. Another life saved in the ER. Story 9. I worked at the ER during my internship and met a girl who had increasingly painful and red eyes a couple of days back. The last 24 hours had been horrible. I asked about all the normal stuff, and she claimed to have no idea why she had this eye problem. She had never had anything wrong with her eyes. I proceed to drop some dye in her eyes to check them in a microscope, and when I do, I realize she's wearing contacts. She didn't like her natural eye color, so she had bought a set of blue-colored lenses 8 months earlier. Never removed them, not even during nighttime. Didn't even think to mention this to me, claiming to have no foreign materials in her eyes. Needless to say, I gave her quite the harsh lecture and a referral to an ophthalmologist. Story 10. When I was doing rounds in the ER for my medic, I encountered this woman. She was in her early 40s and was apparently a frequent flyer for pain meds. Since she had become known in the community, this was a small city in West Michigan, she was no longer able to trick doctors into giving her meds. So what does she do? She pulls out her own teeth. She had tried to do a couple, but they wouldn't come all the way out. She did eventually get one out, but this was after a few attempts. This isn't the stupid part, however. She felt that this may not do the trick, so she waited for a few days, knowing she would get an infection, and we would have no choice but to give her what she wanted. Well, it didn't work. They gave her NSAIDs and antibiotics. Story 11. I have the grandma, the mom, and the teen in the room. The teen is pregnant, but this apparently is a good thing. There are no fathers, grandfathers, boyfriends, jobs in the picture, but everyone decided it was about time a new generation was added to the family lineage. Apparently, the teen did not appreciate the fatigue, full bladder, back pain, etc. that goes along with being pregnant, and is also experiencing some cramping pains. She demands that we do a C-section because she's tired of being pregnant, even though she's still not far enough along. Because then we can just hook up the preemie in an incubator to finish growing, and the government can just pay for the incredibly expensive ICU stay. My jaw just dropped. Please like and subscribe if you've made it this far. I hope you'll enjoy the rest of this video and have a wonderful day. Story 12. Turns out using cement as a DIY cast for your broken but not reset leg is a bad idea. Turns out the chemicals in the cement irritate and dissolve your skin. He became septic and almost died by the time he presented for medical care. Emergency medicine, preventing natural selection one stupid person at a time. When I was a teenager, I for some reason thought it would be a good idea to mix up a small amount of concrete in a bucket with my hands. Because, finding a stick or something is so hard. It turns out that gravel is abrasive and cement is very caustic. This is not something I did a second time. Story 13. General practitioner here. The most outrageous thing I've heard was from a boy who was something like 20 to 22 years old, very poor, illiterate family. The boy had a bad case of tonsillitis and refused to take any meds because all he needed to do was bite the sun. Basically, at noon, he had to look up to the sun, open his mouth as wide as possible, and bite the sun several times so it would burn his tonsils and cure him over the course of a couple weeks. When that wouldn't work, plan B was to do the same at night, but only under a full moon. Too long didn't read, bite the sun and cure your tonsillitis. Story 14. Optometrist here. A guy came in for a glasses exam for the first time in 10 years, and I discovered he had full-blown glaucoma going on, and I asked him if I could run a test to help confirm. He got super angry with me and demanded his prescription. I said, I'll give that to you, but I need to prescribe you medicine to help save your sight. His response was, well, if the good Lord wants me to lose my sight, then who am I to stop him? I made him sign a waiver, and he left. I've never been so frustrated at a patient. Story 15. I had a patient who came to the emergency department vomiting so much I had to admit him for intravenous fluids. I took the usual history, including what he'd eaten recently, nothing out of the ordinary. A few hours later, he called me over. Doctor, I did eat some chicken and rice earlier. My girlfriend made it yesterday, and we left it in the pan on top of the stove overnight, and I ate it this afternoon. This was in a July heat wave. Do you think that could have been it? Yes. Yes, I do. Story 17. A med student, myself, and another student took a history lesson from a guy who drank several 10-plus cups of tea a day with 6 sugars in each one, for my thirst, and had 6 meals a day of 4 bacon sandwiches with butter for the energy. That's all he had every day. That's it. He couldn't understand why his heart disease wasn't getting better, why he'd put on weight, why he was now showing high blood sugar and was borderline diabetic. I too cannot understand why he is borderline diabetic. Story 18. There was this guy whose elderly mother suffered a massive brain hemorrhage, and I had to tell him there was nothing surgically we could do for her. He tearfully told me that he would do anything for his mama, and she could have his brain to save her life. Dude wanted us to do a brain transplant. I had to tell him that, no, unfortunately, that would not be possible. That's terrifyingly stupid, but also touching and sweet in a Forrest Gump kind of way. Story 19. I work as a scribe in the ER, and we had a guy come in asking to be tested because he may have an STD. So we start asking him if he has had unprotected intercourse and multiple partners, to which he answers yes. Next, we ask if he has any itching, rash, discharge, etc. To which he answers no. Well, this guy thought he caught asthma from having intercourse with some chick who had it. Asthma. He thought it was an STD. Story 20. Took care of a patient who we diagnosed with non-Hodgkin's lymphoma. This sweet woman was in her late 20s. For those that don't know, the NHL responds pretty well to chemo. Her father-in-law had a business selling Camels milk. She opted for a Camels milk treatment plan over chemotherapy. She was convinced that Camels milk can treat anything. She said that she came to the hospital just to find out what it was that she was going to treat with the Camels milk. Shaking my head. Story 21. They put a dong ring on for a week solid. Turned up with a dong like an aubergine, color and swelling. No way it could be salvaged. Given a full penectomy, as bad as it sounds, now has a hole between his legs. At least that's the one that sticks in my mind. This is how they castrate sheep and such. A band around the base of the scrotum. They just fall off. Story 22. There was one who was very upset to find out that she was pregnant again because she'd used her diaphragm exactly as she'd been told. She carefully inspected it for holes, applied the spermicide, placed it, wore it at night, then took it out, cleaned it, and put it away each morning. And then her husband arrived home from his night shift. Story 23. Had a girl in the ER who got beer poured over her while at a party. She went to the bathroom to clean herself, but didn't find anything to wash herself with, like a sponge or something, so she used the next best thing she found and meticulously scrubbed her booby-loob-loobies with steel wool. And r/skincare addiction gets worried about facial scrubs. Story 24. While in nursing school, I had a patient who had wounds on his leg and refused wound care because hospitals are clean and you can't get an infection in a hospital. He refused even after having me and then my instructor explain to him about hospital-acquired infections and the need for wound care. Story 25. We had a patient come in for theater. We asked if she'd followed the fasting instructions. She said yes, but luckily the nurse didn't believe her. With some prodding, the patient eventually confessed to having 6 chocolate bars and an orange juice for breakfast. Obviously, the surgery was delayed. Story 26. I had a girl come to the ER for blood spotting and abdominal cramping. She had just started her first intimate relationship and had taken Plan B every day for 5 days because she was worried about getting pregnant. They used condoms and she was already on birth control. Story 27. I had a patient in her 30s complain of monthly rectal bleeding that would last 4 to 6 days and stop on its own. It started when she was 11. She just thought she should get checked out. It did stop for a while when she was pregnant. Story 28. Dentist here. I had a patient a few years ago who could not understand how she had gum disease on her upper teeth. She thought gravity would pull all the bacteria down onto her lower teeth, leaving her top teeth plaque-free. Story 29. Had a patient who was convinced that drinking juice with baking soda was helping him fight prostate cancer. But your cancer is actually getting worse. Him. I'm going to stick with my plan. I really feel like it's helping. Story 30. We had a patient once on a PCA, a kind of pain medicine pump with a button that the patient pushes to dispense more medicine. She thought she had to physically lick the button in order to get the medicine. It was weird. Story 31. We had a woman that went through 3 hospitalizations for diabetic ketoacidosis in 6 weeks. Her glucose was up to 1100. Her explanation is that she didn't like her endocrinologist, so she refused to go back. Story 32. I met one who was taking Lactulose, extra-strength laxative, for her lactose intolerance. To expand on this, Lactulose does contain lactose. Story 33. 14-year-old couple splitting birth control pills to be extra safe. Girl gets pregnant, boy gets gynecomastia. Please leave your stories in the comments. I'd love to make a video of them in the future. Also, don't forget to like and subscribe.